name is Marina Levinsky. I will be your nurse today doing your physical exam. So in general, my patient looks very pleasant, cooperative, skin is evenly toned, his head is normal cephalic and symmetrical. May I touch your hair?
Sure.
And your head. Okay, so his hair is evenly distributed. There's no masses, no lesions, no scars. Okay, can you please raise your eyebrows for me? Good. And first of all, his eyes, nose, and mouth look symmetrical. So you raised your eyebrows. Can you please frown? Smile? Okay, and I'm going to close your eyes. You close your eyes and open your eyes. So they open against resistance. So this tells me that his cranial nerve 5 and 7 are intact. Next, I would like for you to close your eyes, and I'm going to touch you, and you touch where I touched you, okay? Okay, so that tells me that cranial nerve 5 is intact. So I'm going to palpate your masseter, and can you please clench your and frontal muscles? Okay, good. So now I'm going to check your visual acuity. So I'm going to ask you to read the smallest line possible.
LTFPH.
Good. And with the other eye?
LTFPH.
Good. So his vision acuity is 20/20. Okay, so now I'm going to be checking his visual fields for peripheral vision. So when I'm going to put my hands in the back, you're going to, as soon as you see them, you touch them, okay?
Okay.
Good. So that tells me that his peripheral vision is intact. Okay. And then I'm going to check for his corneal light reflex. Where's my... Oh. Okay, I'm going to shine a light on the bridge of your nose, and I want you to look straight, okay? So his light reflections are symmetrical in both eyes. So now I'm going to ask you to do the cover-uncover test. So cover one eye and look straight. Okay, can I see? Okay, now you have to focus on an object. Okay. And so the uncovered eye has no movement or deviation. Do you have to do the same, please? Good. The uncovered eye became also no movement or deviation. So I'm going to ask you I'm going to check your extraocular movements. So I want you to follow my hand. Okay, looking straight, okay? So follow, please, my finger. So he has parallel conjugate movement of his eyes, and this tells me that his cranial nerve 3, 4, and 6 are intact. And there's no extraocular weakness. No nystagmus was present either. So his eyebrows, he has equal, I'm inspecting his eyebrows, and he has equal hair distribution. There's no hair loss, no scaling. They're equally aligned. His eyelids and eyelashes, the eyelashes are symmetrical and curve outward, and his palpebral fissure is equal, and the upper lid does not cover the iris. Covers the iris, but not the pupil, which is within normal limits. Now, can you please close your eyelids? Okay, so lid closure was completed without difficulty. There is no ptosis of the eye. So I'm going to inspect the eyelids, and the lid margins are pink. There's no edema, exudates, or lesions. The margins of the lid are within normal limits. There's no ectropion or intropion deformity. Okay, so blinking is occurring bilaterally and involuntarily. The lacrimal apparatus is, there's no swelling of the lacrimal sac. There's no tissue growth from the peripheral to the periphery to the cornea. And the conjunctiva is pink, and it's not red and not pale. And so I'm going to pull down your eyelid. Okay. So the peripheral conjunctiva is opaque, pink, and vascular. Blood vessels are not congested. Okay, and I'm going to press on the lower lid of your medial canthus. No, you have to open your eyes. Okay, thank you. So there is no secretions came out of the puncta into the eye, and his sclera is white and moist. So now, and the cornea is transparent, has a smooth, clear, and shiny surface. Also, I'm going to check the depth of the anterior chamber. I'm going to shine a light on the side of your eye, okay? And I'm looking for a crescent shadow. Can you please look straight? Thank you. And here. Good. There's no presence of a crescent shadow, which means that the iris is flat and there's adequate chamber depth, which allows the light to pass through the eye. So his pupils, can you look at me? His pupils are round and equal, and I'm going to in size, and I'm going to see for the pupillary response. So yeah, so his pupils briskly constrict, and there's consensual reaction of the pupil, of the other pupil, and that tells me that cranial nerve 3 is intact. Okay, so now I'm going to ask you to focus on a far object, and then move your gaze to right here, okay? So, yes, so his pupils constricted and converged, and that's a proper response. Okay, so now I'm going to do the fundoscope. Okay. Oh, wait. Sorry. So there's a red reflex there. Red reflex, and I'm going to look inside the eye. So one more. Red reflex is present. Okay, and his the optic disc, it has sharp margins, and it's round, and it has clear margins. And also there was blood vessels, and the retinal background did not have any exudates, hemorrhages, or lesions. And now I'm going to be looking at your ears. So the patient's gait is stable when I saw him walking, and his speech is appropriate in loudness. So I'm going to be looking at the external ear, the upper pinna. The ear. So the upper pinna is a little bit above his outer canthus of the eye, and says that is proper air positioning. His ears are symmetrical in size and shape, and also the skin is without any ulcerations, nodules, or inflammation. Okay, so I'm going to inspect the external canal. There's no, okay. So the external canal, there's no cerumen, drainage, no obstructions, lesions. Okay. Oh, so no obstructions, no lesions, no odor. Nothing like that. Okay, so now I'm going to palpate your ears. Okay. Do you feel any pain?
No.
Okay, so there's no tenderness on palpation. So now I'm going to be looking in your tympanic membrane. So up and back. And his tympanic membrane is pearly gray with it's concave, and there's a cone of light reflex. Also, I'm going to be now doing the whisper test. So I'm going to say, I'm going to close this ear, and I'm going to say something to whisper it, and you're going to tell me what it is.
Car 1.
Good.
Apple 2.
Good. Okay, now I'm going to be doing the Weber test. And please tell me if you hear it more in one sound or the other.
It's equal.
Good. No, so there's no lateralization. Now I'm going to be doing the Ryan test. Tell me when you stop hearing it.
It stopped.
Do you still hear it?
Yes.
Yes. That's a proper normal response because air conduction, the same here too.
It stopped.
You
Yes.
still hear it because air conduction is longer. So that's for your ears. So now your nose, I'm looking at your nose, and your nose appears symmetrical. It's similar in color to the rest of your face. There's no lesions, no broken capillaries. I'm going to look at your nasal cavity. Okay, so his nasal cavity is patent. There's no obstructions. Patent and no inflammation. And his septum is midline. Septum is midline. Okay, and without deviations. So the turbinates are dark pink and moist, and the nasal mucosa is also dark pink and moist. Okay, and now I'm going to palpate. There was no drainage. So now I'm going to be palpating the upper nose and the soft tissue, the bridge of your nose and the soft tissue. Can you please tell me if you have any pain? Okay, so he has no tenderness on palpation. The bridge of his nose is firm, and the soft tissue yields to the touch, and no tenderness on palpation. So I'm going to be palpating your sinuses. Can you please let me know if you have any pain? So this is the frontal sinuses, and then the maxillary sinuses. Do you have any pain?
No.
Okay, so there's no tenderness on palpation. Okay, now I'm going to be checking your sense of smell. I want you to close your eyes and close one nostril, please. What do you smell?
Coffee.
Okay, good. And now close the other nose.
Spices.
Okay, good, that's correct. So that tells me that his cranial nerve number 1 is working and intact. So now I'm going to be looking at his mouth. So can you please tell me, what is your favorite food?
Pizza.
Okay, good. So when the patient spoke, he had symmetrical movement of his mouth and lips. There was no odor, and his lips look symmetrical and pink and free of any lesions. Okay, and now I'm going to use a pen light and a tongue depressor and look into his mucosa. So the buccal mucosa is pink and moist. There's no lesions present. Yeah, no lesions present, and it's moist. Now, can you stick out your tongue, please? Okay, so that tells me that his cranial nerve 12 is intact. Also, his tongue looks smooth and moist, shiny, and there was papillae present, and there was no lesions. Okay, so now I would like to look at your teeth. Can I see your teeth, please? So his teeth are evenly spaced with adequate hygiene, and they are white. I'm going to look at your hard and soft palate, please. Okay, so the hard palate is pale, and the soft palate is pink and movable. Okay, and can you please say ah for me?
Ah.
So his uvula is symmetrical and midline. And now the tongue, okay, so I'm going to use the tongue depressor, and I'm going to check your tonsils. Okay, so his tonsils are 2+ and not enlarged and within normal limits. I'm going to check your gag reflex. Okay, so his gag reflex is present, and that means that the cranial nerve 9 and 10 are intact. And I'm going to check your taste right now. So can you please close your eyes? And I'm going to put something on your tongue, and you tell me what it is.
That's sugar.
Okay.
That's salt.
Good. So that tells me that his cranial nerve 7 and 9 are intact. Okay, now I'm going to be palpating his lymph nodes. Okay, so that's the preauricular, and can you please let me know if you have any pain, okay? Preauricular, postauricular, occipital, tonsillar, submandibular, submental. Okay, so do you have any pain? So they're not non-tender on palpation, and they're also kind of non-palpable. So that's a normal thing. Okay, so I'm going to palpate your carotid artery. Okay, so it's 2+ as expected with no thrill. And same here. Okay, and now I'm going to palpate your thyroid. So when I ask you to take a drink, please do so. Okay, you can take a drink. Okay, so his thyroid is smooth and really like non-palpable. It's not enlarged, so it's within normal limits. Okay, and also, and his trachea. Let me connect. And the okay, so when I palpated the thyroid, there was no thrill, and it was smooth and not visible. Okay, so now I'm going to check your trachea, and his trachea is midline and cartilaginous, and I'm going to auscultate the carotid artery now. Okay, so there's no bruit. Wait. Yeah. So the carotid artery, there is no bruit, 2+, and the thyroid is also no bruit. Okay. Now I'm going to ask you to turn your head against my hand. I'm going to put my hand here, and you can turn your head. Okay, good. And same here. Good. And can you please shrug your shoulders? Okay, so that tells me his cranial nerve 11 is intact. Okay, next I'm going to be looking at his posterior chest. I'm going to take off your shirt for a little bit, okay? Okay, so the posterior chest, the color is within normal limits. There's no pallor, no cyanosis. It's symmetrical on both sides, equal on both sides, and within normal limits. So now I'm going to be checking for the thorax. So can you please take a deep breath for me? Okay. Good. So the chest expansion is equal, symmetrical, bilateral, and within normal limits for the lower. And now can you repeat? Thank you. And same as for the upper chest. And his respirations appear regular, approximately 12 breaths per minute, and within normal limits.
Okay.
And then I'm going to be checking for the tactile fremitus. So can you please say 99?
99.
Good.
99.
Good.
99.
Good. So the tactile fremitus is in place. Okay. Now I'm going to check. I'm going to auscultate the heart sound, the respiratory, the breath sounds in the front. So can I ask you? Okay. So can you please take a deep breath for me? Okay. Good. Mhm. Okay. And then. Mhm. Good. Okay. So his breath sounds. Oh wait, I have to check the back. Ouch. Okay, take a breath. Okay, so his breath sounds are clear to auscultation, and now I'm going to be auscultating his heart sounds. Okay, so I'm going to find the second intercostal space, the right intercostal space. Sorry. Okay. So right here. So that's so I'm going to be listening to the aortic valve. Okay. And now to the left of the mid-sternum, I'm going to be listening to the pulmonic valve. Okay. And And now to the third intercostal space, Erb's point. And now the fourth intercostal space is the tricuspid valve. Okay. And then the fifth intercostal space, mid clavicular line, I'm listening to the mitral valve. Okay. So his heart sounds are present in all locations, S1 and S2, and there was no additional heart sounds. Okay. So now, can you please lay down? I need to check your jugular vein distension. Lay down. Oh, and I need to put you onto a 45-degree angle. Here you go. Okay, good. So now I can see his jugular vein, and I'm gonna use it to measure. Okay. So it's from right here. So it goes to like 2 centimeters. So anything within less than 4 centimeters is considered within normal limits. And now I'm going to be, so I need you to lay down. And I'm going to be palpating your apical pulse, or the point of maximal PMI impulse, point of maximal impulse. And the point of maximal impulse is in the fifth intercostal space, and I feel it. It's brisk, and it's not pounding, and it's within normal limits. And now I'm going to be palpating and auscultating your arteries. So the aortic artery first. I don't feel any thrill, and there is no bruit. Now I'm going to be checking his renal arteries. No thrill. And no bruit. And now I'm going to be checking his iliac arteries. I don't feel any thrills. And there's no bruits. And now the femoral artery. No thrill. And no bruit. No thrill. And no bruit. And so they're all +2, no thrill, no bruit. So they're as expected within normal limits. Okay, now I'm going to be palpating and inspecting your pulses. So can you sit up for me, please? Okay, so his upper extremity pulses are his radial pulse. Okay, good. His brachial pulse and his axillary pulse. Radial pulse, brachial pulse, and axillary pulse. And can I check your capillary refill? Okay, so his pulses were 2+ with no thrill, and capillary refill is less than 3 seconds. Okay, now I'm going to be checking your lower extremity pulses. So the femoral pulse I already checked. The popliteal pulse, the posterior tibial pulse, and his dorsalis pedis is present. Okay, so popliteal, posterior tibial, and dorsalis pedis is present. And I'm checking his capillary refill on both sides. And if capillary refill on the lower extremities is less than 3 seconds, and the lower extremity pulses are 2+, no thrill. And that is it for the examination.